the challenges we have, and this is where we're going to get the lead in now into polio, is that vaccine rollout has been very asymmetrical across the globe. Obviously, countries that are of higher socioeconomic status have been able to pay for and get vaccines. Most of them are manufactured in those countries. But in many parts of the world, including Africa, the vaccination rates are actually quite low. And this is as of measured from October 18th, just a couple of days ago. So we're still really challenged. And of course, it's probably very, I think, pertinent with Rotarians because of the polio vaccine rollout and how we've recognized how challenging it's been since the eradication initiative was started in 1988. So what's the connection? And the connection really between COVID and polio is one of the challenges, one of the things that we never thought might happen, once we showed people how effective they were, was that actually it created a massive upsurge in anti-vaccine disinformation. And it was basically based on the fact that the mRNA vaccines were a relatively new platform. They're not actually that new. We've used mRNA vaccines in malaria and rabies actually since the early 2000s. But it was a very new thing for a mass vaccination. And so people had the ideas, well, RNA, isn't that like part of your genetics and things? And RNA is really a messenger. It's the DNA or genetics. But people who didn't understand it or had a very rudimentary understanding thought that if I gave you RNA, you would convert it to DNA and it would get in your genes and it would reprogram you to be like, you know, I don't know, Gates or something like that. So they made all kinds of aspersions about safety and everything else because, you know, they were new platforms. So we didn't have lots of safety data. We had, by the time they rolled out, we had about 6 months of safety data from the large numbers of recipients in the Moderna and Pfizer trials and the AstraZeneca trials, although we're talking about mRNAs. And the other thing that happened is at the same time, of course, this anti-mandate political ideology, which is very much driven by an ideological sort of spread, latched on not just to masks and not just to mandates about lockdowns, but the vaccines, because weren't they all part of the same conspiracy to control the world through something called the One World Order? I'm fascinated by this One World Order. The only time you find that mentioned is on Facebook and Twitter and other places, because it's all part of actually something that many of you know, if you're historians, has existed since, gosh, the Middle Ages, which was the idea that a select group of people were controlling everything. And frankly, one of the biggest challenges has been anti-Semitic in its tone, the idea that somehow Jewish people were the part of the One World Order, which is, of course, total unadulterated bullshit, pardon me for like and then the other thing that it created was a lack of access to primary care. Physicians who are running primary care offices, your family doctor, were really worried in it, and they really converted over to a lot of virtual stuff. They saw very few people. But one of the most important things we know about vaccinations, primary care docs are they're the foundation stone for vaccination, routine vaccinations. And people trust their family doctors for vaccination information and for all those other things. So children now were starting to fall behind their routine childhood immunizations, one of which, of course, is polio vaccination. So the picture there, by the way, is Peter Hotez, who's one of my IT colleagues down in Texas. And he has a son who actually has autism, and he became a very significant counter argument to that Andrew Wakefield guy, who we can't even, well, we can call him doctor because he has a degree, but he's been struck from the register, as they say in England, because he was promoting the absolutely incorrect idea that measles and mumps rubella vaccines caused autism. By the way, right, even the courts have looked at that. And remember, the courts are kind of a little bit, oh yeah, maybe. They've actually said, no, there's no evidence whatsoever. And I can tell you scientifically, there is none at all. And so this turned into this huge, broad, I'm not going to ask you to look at this, but it's to sort of show you the sort of spider web created by anti-vaccine sentiments and the concerns that arose from them. And some of them are legitimate concerns, like, do you have long-term safety data? No. Okay, well, that must mean it's going to hurt and kill people. The most fascinating one, and I was approached last night after I gave a talk at St. Lawrence College and participated in a forum, a lady who came up to me and said, well, you know, Dr. Evans, lots of people have died. There's a lot of excess mortality, and it's only happened since the COVID-19 vaccines were rolled out. I'm like, the other thing, man, was that there was a pandemic going on that was killing lots of old people. It's also possible that that's the confounding signal that you're not looking at. But when you get your information from Facebook and from Twitter and assorted other bad places, yeah, it just seems like a lot of sense. Some of you may have heard about the Florida Surgeon General is a known anti-vaxxer, which is why DeSantis hired him in that job. And he put out a study, very badly designed if you're a scientist to look at. I mean, to suggest that the vaccine was killing young men from heart disease. And it's so fundamentally flawed, I can't even bother to show you what the sort of things were, but that's the kind of stuff that has been propagated, and it's been propagated by high-reaching authorities. The Surgeon General of the state of Florida says it's killing young men. People will go, well, that's a doctor, and he must know what he's talking about. No, there's a lot of bad doctors out there. No, I should say that. There's a few bad doctors. There's always a few. I almost did it again. My wife always accuses me of exaggeration, and she's right. Too much hyperbole. So that leads us into the whole question of what has that impact had on paralytic polio, or polio in general, which is, of course, a vaccine preventable disease. I found this picture in there's a really good report, you've probably all seen it, that was put out here in Canada. And this nurse showing a man who suffered from polio and was in a kind of one of these small iron lung type devices, which use negative pressure to let them breathe, to sort of show the headline that ends the polio thread. I'm sure that gentleman was like, darn, just a little too late for me. But people who knew about polio, experienced polio, understood that a vaccine that would prevent this absolutely devastating, tragic disease was a huge leap forward. And vaccine uptake was massive. This is just a little bit about the history, and this is a graph actually of polio in Canada from 1927 to 1962, recognizing that the injectable polio vaccine was introduced in Canada at 55, same time as introduced in the States. In 1953, there were almost 9,000 people affected by polio, and it killed 500 people. And people who didn't get killed suffered long-term consequences of the motor neuron effect and the reduction in their ability, to move their muscles and stuff afterwards. Because after the introduction, though, it took almost 20 years to get rid of the last recorded case of wild poliovirus infection in Canada, which was in 1977. But you can see this huge fall off on the right side from 1953, the worst year that we have recorded, down to where things were by the early 1960s. So this vaccine had a tremendous, tremendous impact on reducing poliomyelitis as a disease. I think all of you are aware there's lots of different polioviruses. There's 3 wild types. Of course, there's a vaccine-derived poliovirus that comes from the Sabin vaccine, or the oral polio vaccine, which is a live virus vaccine. The good news about polio, which is different from COVID to some extent, is that there's very little heterotypic immunity. So one of the problems we've had with COVID is if I gave you the ancestral vaccine, which all of you probably had, by the time Omicron had evolved, it was immunologically evasive from the immunity that I gave you with the ancestral vaccine. Not completely, but a bit. With polio, it's fairly standard. If you have infection with one, you're usually developing immunity to the others. And if you've been vaccinated with any of those strains, it will protect you from the other strains. Polio, of course, is worldwide in its distribution. The reservoir is just in humans. As far as we know, polio does not affect other animal species. It's a classic waterborne pathogen that has this fecal oral route. And we didn't realize until later, that summertime, when you saw all the polio outbreaks before the vaccine, were all because that was exposure to fresh water. And it was fresh water typically the end of summer, where there's been an opportunity for the virus to replicate and appear in large numbers. And so kids would go into a local lake or a swimming hole, and they would get polio because they were ingesting it when they were swimming in the water and getting accidentally swallowed water and stuff. And the problem, of course, is that if you're infected with polio, that virus will be excreted for quite a long period of time, upwards of a month or so after being infected. Even though the vast majority of people who got polio virus infection, actually were asymptomatic. So it's always useful. ID people always have to explain to people, you can be infected with something but not get the disease. And that polio is a nice example of that. Actually, the minority of people actually end up with the paralytic form of polio, but it was enough to create these really, really tragic stories. So of course, we have really 2 vaccines. There's the inactivated vaccine that was developed by Jonas Salk, and an example of a good scientist who said, I could make a lot of money by patenting it, but I'm not going to because we need to save the world. And so he allowed all kinds of, here in Canada, it was Connet Labs, I think, which was a big vaccine manufacturer that actually created the vaccine for Canada. It's very effective. After 3 doses, almost 100% of recipients are now immune to polio. Duration was a little off, so that's why you're still recommendation probably about every 10 years you get a polio shot, especially if you're traveling around the world. And in 87, we actually developed an enhanced potency one. The other one that was developed by the French researcher Sabin was the trivalent oral polio vaccine. And it was kind of cool. When I was in medical school, we learned about what was very effective about it in controlling large outbreaks in many parts of the world. It was easy to administer. You didn't have to have a needle. And what that did is that the children who were infected with it or were given the vaccine would excrete the polio virus, the vaccine-derived polio virus, into the surrounding environment. So kids who didn't get the oral polio vaccine would actually get vaccinated inadvertently because they were being exposed to the vaccine strain. And so it was very good at cutting down polio outbreaks in many parts of the world. The only challenge we have with it, of course, that you guys know, is that if it exists long enough, it will revert back to its wild form, and then it can actually cause the disease. And that's a real challenge. And that's why the inactivated vaccine has been used more broadly. Canada actually has lots of experience with using both vaccines, the oral polio and the injectable polio. You can see here some broken down by provinces, sort of what people did and didn't do. And of course, we've now included it with all the pediatric vaccines so that if you take a kid in now, they get Pentacell, which has 5 different things in it, or even, I think there's a Heptavel now, which has 7 different things, including polio, as part of the vaccine that they get routinely through childhood. So the Global Polio Eradication Initiative started in 1988, and it was based on the principle that we had already learned from smallpox, which is that if you only have a human reservoir for a pathogen and you can make all people immune to it, then you would literally eradicate it from the globe. So everyone knows that we eradicated smallpox from the globe in 1982, except for all the smallpox strains that are held by different countries in their labs because they're worried the other guy's going to use it. So the Russians have some, Americans have some, the Brits have some. But it's certainly an effective strategy to literally eradicate a pathogen from the planet. And by 1994, the Western Hemisphere was certified to be polio-free. And the last wild polio virus type 2 that was ever found was in India in October of 1999, and it's now gone. But you can see it was an intensive effort, but it took almost 30 years to take us from what was at that point over 250,000 polio cases a year down to just 8 by 2017. And this next, you can see that's just a slide to show you the affected countries difference between 1988 and 2015. And this is what we're talking about with the wild polio virus being eradicated in India in 2015, and therefore it was withdrawn from the Sabin vaccine. And we're working, now we think poliovirus 3 is gone, and the only one left is the wild poliovirus 1, and it exists really only in 2 countries right now circulating, which is Afghanistan and Pakistan. So let's get back to childhood vaccines in Canada. You can see here that, this is a survey from prior to the pandemic in 2017. One of the highest rates of vaccination was actually against polio. And they looked at Canadian children before their 2nd birthday, how many of them had at least 3 doses. And it was very high. It's still not quite the black line, which is the threshold we like it at, but it was really, really high. And it approached the same thing we see with measles, mumps, and rubella, a little less with diphtheria, pertussis, tetanus, the DPT. So that looks impressive. If you break it down by provinces, so you get into some details, and this is hard to see, but I'll just point out the provinces that are still, and territories that are challenged, are Nunavut at 82%, British Columbia at 87%, and Manitoba at 85%. All of the others are above 90%, although Ontario is just above it. Well, actually, no, it's New Brunswick. Probably a lot of it demographics. My colleagues always point out that Manitoba has a very large Mennonite and Hutterite population, and they usually do not like this kind of technology. British Columbia is fascinating, but for us ID people, I'm just so glad I don't practice in British Columbia. There is just the west coast of this continent just has the most unusually different people than the rest of the continent. Is that the nicest political way of saying it? Yeah. So that would explain it. Nunavut could be an issue of delivery with a large rural community, the population well spread out and stuff like that. But just to sort of suggest to you, it's not uniform. The other one that's really scary is unvaccinated rates that we're seeing in the National Immunization Coverage Survey in 2017, just before the pandemic. And here you see the same provinces popping up. British Columbia, almost 3.9% of children were not vaccinated at all. In Manitoba, 3.8%, to 8. And I guess the next highest one was Quebec at 2.97. So that this is really worrisome, because to be unvaccinated means your parent has made an explicit conscious decision, probably in the majority of these cases, not to have their child vaccinated. I don't think it's a 2-month-old going, no thanks. So anyways, this is the real challenge we have. So the problem, of course, that's had been at the forefront of this is the COVID-19 pandemic has fueled this backslide in vaccinations. And it's the largest that we've seen in 30 years. And to sort of show you what's happening, this is Quebec data over here. This is a DTP containing vaccine, so it's probably going to be something like that, so which has polio in it. The dotted line is 2019 before the pandemic, and 2020 is the solid line. And you can see the vaccination coverage in 3-month-olds in the top graph, 5-month-olds in the lower graph, how they dropped off. This is Alberta data. And it shows a really big drop off. The different lines are different doses, the first, second, third dose, or a 4th dose. And those really dropped off. And the 4th dose drop off was the biggest one. So those would be children just about going into school, right? Because you get 2, 4, 6 months, and then 18 months, and then you get another shot before you go to school. So they really dropped off. And that's Canadian data. The other data we have is from countries like India. And the red arrows show you all of the different kinds of vaccines. Some are oral polio, some are injectable polio, some are first doses. It actually goes from left to right, mostly first doses, then second and third doses, and then boosters. And these are drop-offs in vaccinations in India, which are, roughly, I think if you average them out, they're probably sitting at about a 30% drop-off. In a country that is just adjacent to, another country that has wild polio virus still circulating around. So this has been the real unfortunate sort of byproduct of the pandemic. And then just to bring everybody's attention to this, and you've probably heard about these, there was a case of paralytic polio in Rockland County, which is just to the northwest of New York City. It was an unimmunized individual, a young adult, who got all the classic signs of polio and developed, in fact, paralytic polio. That diagnosis was made relatively easily. And interestingly, it wasn't because, this individual had just returned from some other part of the world, like Pakistan or Afghanistan, and had just attended a large gathering where there were other people around. And it was about a week before, so it fits the incubation period for polio. And it created a big issue, because this is what they had to do afterwards. Once you see a case of polio, you're now looking for active case findings of other cases. You're looking at enhanced surveillance for any kind of enterovirus positive disease, because polio is one of the enteroviruses. You have to look at asymptomatic infection, because the vast majority of people actually get asymptomatic infection. So you're looking at collecting stool samples from various individuals. And then, of course, you're doing wastewater surveillance in certain parts of the country, in this case, Rockland County. And then, people said, oh, well, it's not in New York City, except, of course, they have ended up, because they were doing wastewater detection, they found it in the New York City wastewater. So how big is New York City now? Is it like 15 million or something, or is it even bigger? I can't remember. Somewhere around 12 to 15 million people or so. So, polio zipping along in New York City would not be a good thing. And then on top of that, we've seen some signal elsewhere in the world that in 2022, there were lots of cases reported, at least 249 laboratory confirmed cases in various parts of the world, in places where you might expect to see it. Lots of green here in the Arabian Peninsula, for those of you who know, I think that's Yemen, where there has been an ongoing civil war for years. And then you can see large outbreaks in Nigeria. This is in Zaire, which is now the Democratic Republic of Congo. Sorry, I forgot to change the names. There's, of course, Afghanistan and Pakistan. So this is a big rise in cases outside of where we'd seen it before. So it's a real challenge to the initiative to eradicate polio, which Rotary has been involved in for many, many years. So I'll just finish by saying the real connection here is that the pandemic has set back the global polio eradication initiative by years now. It's reduced the ability to do vaccine campaigns. Everybody's heard about vaccine workers being murdered and killed. And it's increased anti-vaccine sentiment outside of what were the core anti-vaccine groups. About 10% of the population in the Western world is anti-vaccine, but there's about 10% of the population that's very susceptible to messaging because they're sitting on the fence or whatever, what we call the hesitant group. And that's expanding, unfortunately. And then we've seen this huge problem right in our own backyard of reduced vaccination of children that's caused by the pandemic because people really couldn't access their primary care doctors or family physicians in order to get their children vaccinated. So that's been a real issue. So we have to redouble our efforts to catch up with all those lost vaccine opportunities because we're at risk. There's nothing to, the world's a global community now, and people can travel from areas of the world where it's more endemic and reintroduce it in here into the water supply, et cetera. And then, of course, we have to redouble our efforts to counter disinformation from anti-vaccine adherents. And they've really had just a heyday with the pandemic. I sat on the behavioral sciences working group, which was really good. I'm not a behavioral scientist. I was the content expert for ID. But these guys really understand what motivates humans and what creates the problems that we've seen during the pandemic. And it is unfortunate to sort of see I think the maluse, the misuse of social media and other things to expand what might be your own personal ideological view. When you were kind of a crazy weirdo in the old days when I was young, all you could do was make pamphlets up and stick them around the village. Now you can just go online and just broadcast it, and these people exist in bubbles, which allows them to kind of propagate all that stuff all over the place. So anyways, that's the connection, and I think, of course, very important to Rotary. So thank you very much and appreciate the invite.